I got the first call, first of all, I was ecstatic because I had gotten a call from Beck. But yeah, you're a rock star in our field. So the work that you've done has actually changed people's lives. I mean, it's fundamentally changed so many people's lives who have been quite literally stuck on an inpatient unit for months because we haven't figured out how to help them so that they could live independently in the community. And in a very short period of time, introduce a treatment that helps them to get to the point where they can go into the community and be successful. I have a belief that if we really want to help people to recover, that we need to bring in the best science to help us do that. And cognitive therapy obviously had a very strong track record. The science was there. We knew that it worked. But what really excited me about the call was we were at the beginning phases of our transformation, our efforts to transform our system around the principles of recovery and resilience.
Think that recovery has certain goals, which in general could be comprised under the label of integration into the community, having a sense of self-respect, dignity, control over one's own life, independence, and meaningful relationships with other people, which is really key. So that's the aim. Now, how do you get to that?
Exactly. That was a crux of the matter.
How do you
right.
do that?
Exactly.
The radical thing is to throw out this whole idea of mental illness and disorder as a label. Once you talk in terms of illness, then you're going to focus on symptoms, then you're going to focus on treatments to do away with the symptoms. Now, in many ways, that is contradictory to the mission of recovery.
One of the things that's often missing in traditional approaches is that we tend to focus on what the symptoms are, what the pathology is, without a recognition of what the strengths are and how to build on that.
Let's take the individual from patienthood into personhood, and let's start viewing them as a person who has a lot of needs, who's in distress, but we want to ignore the distress for a while, forget about the usual forms of treatment, and let's trade on their interests, on their motivations, and let's see what we can do to satisfy those needs.
Those are things that I think go to the fundamental shift that we're trying to make in terms of how mental health systems are organized and how services are delivered. It's a big shift for systems and organizations to start focusing more on strength and enhancing strengths as a way of helping people with the challenges that they have.
I can see why it would be a big shift for the organizations, because it's been a big shift in my own mind.
That shift really required a lot of both engineering of the system, but it also required a different set of skills. And I think that when you are managing a large system, so we have $1 billion system, we have 200 providers, we're serving over 100,000 people each year. It's a lot of complexity, and what we really needed to do was move from the idea of thinking about training clinicians to how do we build organizational capacity. This was about a different paradigm around how we actually did training. It's one thing for me to say recovery works. It's something different for someone who may have been homeless, living on the streets for 13 years, to stand up and say, I'm in recovery and here's what helped me. It's important for our field and for the broader public to know that it is possible. People don't believe that people who have serious mental illness are going to get better. People don't believe that people who are homeless and living on the streets for 13, 14, 20 years can ever get better. People don't believe that people that get incarcerated because they have a mental illness are ever going to be in a position where they can go to work and have a life. And those things, I believe, constrain our ability to actually help people. And I think what's so exciting about this work is that we're demonstrating that you actually can make those changes. You can help people who, frankly, people have written off, and people who've written themselves off. And so I think it's a really important story to tell that can be helpful to other systems that are having the same struggles that we're having here in Philadelphia.
Unless we get this out into the outside world, it's not going to help the millions of people that really need this type of approach. So it's really critical that we devote part of our time and energy to being able to educate other people on what we're doing.
So I agree. I think we have to take show on the road and hopefully both share but also learn from other people who are doing similar kind of work.